Good morning, everyone. Welcome to the April 18th Joint Board of Health and Hospitals monthly meeting. I'm very happy to be here and to join you as your new chair. Since we've established quorum, I'm going to call the meeting to order. And you should have a copy of the agenda that I sent out to everyone earlier in the week. So the first piece of business is to approve the March 21st, 2024 Zoom video as our meeting minutes. Is there a motion?
I motion to approve the minutes.
Second.
Thank you. Sorry, who just made the second?
Colleen.
Okay, thank you. All in favor of approving the March Zoom video as minutes, please say aye.
Aye. Aye. Aye.
Aye.
Is that it? I'm going to say the ayes have it, and our March minutes have been approved. The rest of this agenda today has a few different parts. The bulk of the meeting will be taken by the Department of Health and Senior Services. We get to undergo a board orientation later. But first, I'd like to just start with a welcome to everyone who is a relatively new member of the board, as well as folks who have been on the board serving for a while. I will start by just saying that, again, I'm very excited to be here serving as your chair, and looking forward to getting to know the folks that I don't yet know or don't know well. But I might need a reminder on who's here for their first meeting aside from me. Dr. Ludy, all right. Do you want to say a few words?
Good morning, everyone. I'm excited to be here and hope I'll be able to contribute. I think I'll just abbreviate. I'm a physician. I did my internal medicine, pulmonary critical care training at Barnes. My particular passion is collecting uninsured, underserved, and unhoused people to services. I am connected with Affinia St. Patrick's Center and hope that I'll be able to contribute to the work of this group.
Thank you so much. It's wonderful to have you here serving. For those who don't know me, I have lived in St. Louis for most of my adult life. Attended WashU for college, moved away and moved back. So this is home, and have been working in the healthcare, not-for-profit, and community health space for the past 15 years, and am currently running my own equity strategy practice. So I am excited to be a part of furthering the mission of improving public health for the residents of our city. Are we the only two newbies here today? Liz, yes, please.
Hi, good morning. I was on last month, but I'm also seeing a lot of newer faces this month. So I'm Liz Wright. I'm from St. Louis, born and raised. My background is actually in clinical social work. I too worked at Barnes for some time before transitioning into more administrative spaces, first with an administrative fellowship at Barnes, and then latter supporting their chief nurse executive. I currently work for Optum. It's part of United Health Group. So part of my role is working with different health systems across the country that we have partnerships with to improve their care delivery, but also heavily get involved in their communities so that we are holistically supporting our partners. And I'm excited to be here.
Thank you so much. All right. I think that might be it for the intros. So I will move to the next agenda item. Dr. Mati, do you have any updates that you'd like to share?
Sure, I'll be brief. I wanted to first ask, do we know if Tiffany from the States has made it on and is able to?
She was trying to join by phone. She was having difficulties getting on through the computer. So she's trying to get in.
Okay,
Hold on, she just sent another email.
have you sent her the link, Rhonda? If you could work with her and try to get her the link, that would be helpful while I do departmental updates.
Will do.
Thank you. Welcome, everyone. This is a wonderful period in the history of the board. We have never had this many new board members. We're ushering in the leadership of a new chair. I want to wholeheartedly extend my welcome and appreciation for April Jolly, whose leadership at both the regional and national level will only enhance this board. I want to congratulate Kristen Simpson for now being vice president, having served on this board for the past year, being extraordinarily active, working closely with the health department during that time. I want to extend my sincere welcome to all the new faces from this meeting and last meeting, specifically Morgan, Liz, Barbara, who are on the call today. I want to say hello to the OGs. We made it, guys. We're all here. So Dr. Tepe, Colleen, this is just such a rich and vibrant board. I'd like to encourage you all to just take some time and do the Google each other thing, not just to be snoopy, but also because you will really be enriched by the strength of this board, the experience on this board, the passion on this board, the life work that's represented. The health department is finalizing all of your appointments. It takes some time for them to be fully approved through the mayor's office. And at that time, we're going to update the website. At the next board meeting, I will show you where that link is. I want you to share it with your friends, and that will be also an opportunity for you to see everybody who is there. I'm going to briefly just do some, give you a sneak peek of the monthly report. Can everyone see my screen? Great. And so as usual, the communications bureau have done a beautiful job. As you can tell, they're having a lot of fun, not only highlighting all the amazing work of the health department, but the artwork. They're being really intentional about giving you visuals from all over St. Louis. We are getting a lot of requests for broader reach for this monthly report. So in May, we will be expanding the reach of who gets it. For all the new board members, you will get this the day after every single board meeting. We ask that you read it with intention. Active board members, Dr. Tepe, Colleen, Kristen, are the types of folks who follow up questions, give advice. They have helped to really strengthen the quality of this over the past year. I'll give an example of when Dr. Tepe really sort of looked at our women's health initiatives at the beginning, at the sort of the earlier iteration of this. A lot of really strong conversations came out of that, and the bureaus were able to really strengthen what it is we do in that regard. So really want you to do that. I want to highlight certain parts of this for newer board members as well. So the first thing I would do is draw your attention to, there'll always be a little intro, a few words about what has happened in the prior month and areas of priority for the health department. This is the cheat sheet for if you don't have time to read a lot. These are the high impact, like what are the biggest things that were happening in the prior month. We have been extraordinarily active. We were sponsored fully by the National Medical Association. So the fact that this health department has now made a national splash and national organizations want to sponsor events for maternal child health. We had over 120 participants at the Missouri Foundation for Health who graciously hosted us. Mayor Jones was in attendance. We had a panel of incredible leaders, and it was just incredible. Many thanks to the board members who came out to support. Our board chair was in attendance and very active in the participation of discussion. It was a truly remarkable time. We then released our chip and in collaboration with the county. So that's the middle screen. Again, Mayor Jones, Dr. Page, and a host of different partners, the leadership and the different committees in the CHIP have incredible representation. We have over 50 community-based organizations, hospital presence, and of course, in partnership with our partners in the county. So I will ask, because all of you are new, the active board members were pivotal in the accreditation application that we made in January, made a lot of comments, strengthened that application. So I will ask Rhonda after this to send the final chip to you, April, and then you can disseminate to the board just for your awareness. And that's a huge part of what we're doing. We're now in the implementation phase. And then lastly, HRSA, again, chose St. Louis. We are really making a splash at the national stage and brought the ACIMM committee around infant and mortality and maternal mortality. I was asked to present, and the health department had a very strong showing. Our bureau chief and Bureau for Family, Children, and School Health were also asked to join some high-level meetings. And so it has been a really strong impact month for March. What you will see after that are a couple of slides that just speak about either an employee appreciation or data around certain disease states that we think are important. So right now we're at the tail end of respiratory illness season. That graph is one of the happiest things that an infectious diseases doctor and director of health can ever see. You can see that across the board, we're seeing dramatic decreases in COVID-19, influenza, but allergy season is hot right now, and I know a couple of you are feeling it. The rest of this report I will not go through in the interest of time, but you will see information on all of our bureaus, behavioral health, what are our activities, a couple of key metrics that we're following, and we use the same metrics for accountability as part of our KPIs as well. So it's HIV, STI, surveillance and prevention, communicable disease, family, community, and school health. You'll see what's happening around environmental health, and then our health promotion, education, and marketing as well. The most important, this is where if you're kind of responding to emails or playing solitaire, I'd really ask you to look directly into your camera, thumbs up to me that you are. Yep, I see my thumbs. We need your help. I need you. We put you guys to work. So I've asked that you kind of look each other up. My second request is to send out to all of your networks the request for proposals. We have links out for you. You can just copy and paste. We need people to apply. Right now, we've got an RFP out for the City of St. Louis animal shelter operations. This was a big advocacy issue, and a lot of you sent emails in support to the mayor's office, and we thank you for your advocacy. We also have a consultant to evaluate City of St. Louis Department of Health programs. I need your help here. Any consultants or folks in your networks that you know that could be a consultant to come in and help us look at KPI development, programmatic development, and just ways for us to really look at how we're doing with our economic evaluations, our quest for health equity and justice. The language is all here. You just have to copy, paste, and we've got hyperlinks in for you as well when this report comes out. And the last one is a consultant to evaluate is the second that we split them in two, one that's more performance-based and one that's around equity and other portions. So if you could please, we've put in a lot of money to support these efforts, and we really would like folks to apply. And it's a great way for us to also invest in the region. So those requests for proposals, we are asking every single board member to please distribute to your networks on our behalf. Well, we appreciate it. The next part that you should always pay attention to is we give you upcoming events. We expect you to be an active board member, so you need to show up for us, please. Be there in person, put them on your calendar. We give you a month notice. So we have the events for May. If it's just me speaking, please leave that alone. But if it's like the whole department is doing something, that's what I mean. You guys will be like, oh my God, this woman just wants us to follow her around town. Please do not feel compelled at all. In fact, I would prefer if you didn't follow me to my speaking engagements, but when the department has departmental ones, you'll see them here. And then the last thing is, you may have read in the news that we have a hiring freeze, but all active jobs on the website in the city are still up for grabs, and we really need to fill those, especially because we are in a hiring freeze. So you will get hyperlinks to those active area as well. I will stop here and take any questions. And then we will transition to board training.
When you send this document to me, will all of the links be in the document, or will I need to also copy and paste them into an email?
So when we send it in that sort of newsletter form, and then there's a more narrative form that is easily just copy and pastable into your own emails. Yeah.
Thank you.
Any other questions? All right, I will hand it back to our board chair to introduce our trainer from the state, Tiffany, who has joined us.
Thank you so much. I am very pleased to have Tiffany Bayer here, who is from the Department of Health and Senior Services, who will be offering all of us an orientation on service for members of boards of health. So, Ms. Bayer, I will let you take the floor.
Good morning. Can you hear me?
Yes.
Okay. My apologies. Zoom is not the platform we normally work on, so I had to do some downloading, and the state does not love us downloading things, so I had to get some permission. So my apologies for the tardiness on getting on. My name is Tiffany Bayer, as I was introduced. I am the director for the Center for Local Public Health with the Department of Health and Senior Services. We are actually under the Division of Community and Public Health. So we look, the division that we are placed under looks a lot like what the local public health agency would look like if you look at the organization as service oriented. So we, our division provides the WIC services, environmental services. So we reflect a lot of what occurs in the local public health agencies. And the center that I work in, we are what we call middleman between the department and our 150 local public health agencies. So we were lucky enough that the governor, the session before last, so not the current session, of course, he approved a general revenue piece to offer an incentive to our local public health agencies that we get to put different components together and offer incentive pieces to complete to our LPHAs for the advancement of public health. One of those components is training for our local public health boards. And I know that so many people on here know the ins and outs of public health. And so I changed it up a little bit for this group just to kind of give a good pulse of what's going on in public health and really what the department is working on currently and what we look at in the future. rather than just the Public Health 101 and statutes that I kind of normally go through with folks that may not be as familiar with public health. So apologies, my camera is also not loving me this morning. So I am going to work to share my slides, which I hope I can do, and we will go ahead and get started. Please let me know if you have any questions during the presentation, and if not, I'm happy to take questions afterwards. And I apologize for my voice. I did this 3 times yesterday, so my voice is a little bit on its last leg. So I will definitely make it through this piece, though. So I think I can share. Oh. Rhonda, I may have to see how I can share my screen, as I don't normally work in this platform.
Do you
Tiffany,
have a
this is
screen?
Kim from the health department. Do you see a green share button at the
Oh,
bottom of your screen?
There it is. Yes, thank you. Okay, my apologies. Let's see. We will go ahead and start from our beginning. There we go. Okay. This is just my contact information. Anyone is always welcome to reach out, contact us. We are located in Jefferson City. We are one of the lucky ones that are all located together. So our department sits in 3 buildings here in Jefferson City. We do have a couple of offices, regional offices scattered, but they are very small offices. So most of us are here in Jefferson City. So today we will just kind of focus on 3 main pieces. So we have public health past. So we'll discuss a little bit where we have been and our greatest achievements, our public health present. So what is happening in public health right now, and our public health future. So goals for the future of public health and the roadmap to get there. Just a little bit of brief history. Public health, let's see, here we go. Public health nursing in the United States began in the late 1800s. It was really through efforts of a few wealthy women in the New York, Boston, Philadelphia, and Buffalo area who hired and trained nurses to care for the poor in their homes. In March of 1883, a state board of health was created in Missouri. So really the purpose there was to protect citizens against diseases such as smallpox, typhoid, cholera, and other communicable diseases. In St. Louis, visiting initiated in 1895, and the Visiting Nurses Association was incorporated in 1911. In 1919, an agreement was reached between the Missouri State Board of Health and the Southwestern Division of American Red Cross Society, providing a director of the Division of Public Health Nursing and the Department of Health. So really that purpose was of the division was to organize, coordinate, and supervise public health nursing activities in the rural sections of the state. In the 1940s, the nursing division assisted in the development of regional education conferences and offered scholarships to assist nurses to further their education. And in 1945, the Missouri Constitution provided for the establishment of the department to correlate health and welfare activities, and Senate Bill 349 was created. Such a department, the Department of Social Services, was created in 1974 and included several divisions, and the Division of Health was one of those. And the title of public health nurse was changed to community in 1976. Oh my goodness, did I just end up not sharing my screen now? I just keep clicking on things and it's not taking me where I want to go. My apologies. And so then we were lucky enough to establish the Department of Health, which was created in 1987. So we really look to Lillian Ward as the founder of public health nursing here in the US. She was the first to use the term public health nursing. So really she had the vision of nurses as guardians of public health. And she established the Henry Street Nurses Settlement and the Visiting Nurse Service of New York. So we talk about, we do have 100 years of great public health achievements. This is really a snapshot from from 1990 to 2000 alone. The United States has gained 30 years in life expectancy, and 25 of those 30 years are attributed to public health efforts, including the 10 public health, the great public health achievements, which are listed here as declines in deaths from heart disease and stroke, fluoridation of drinking water, immunizations, safer, healthier foods, workplace safety, and our next 5 are healthier moms and babies, control of infectious diseases, motor vehicle safety, family planning, and tobacco as a health hazard. And so the one thing we like to point out is, of course, we've made in all pieces of the 10 items that we just covered, but we also know that we take many steps forward, but a couple steps back as we know that tobacco, even though we have made great strides, now we have, our young folks using tobacco and more of the e-cigarettes trend, and we have an extremely high rate of our young people using e-cigarettes. We know that we have healthier moms and babies, but we by no means have little work to do there, as we have many mothers who are not able to seek the care that they need during their pregnancy. And we're working towards how to help those moms get the care that they need. And so that is true of many of the pieces that we covered, including fluoridation of drinking water, as we have several counties and cities that are moving to remove fluoridation in their drinking water, as it's a very expensive piece, and they do not feel that it is a piece that they want to continue to upkeep, although we know it is important to our young kiddos that for their dental development, and most oftentimes it is a key factor in preventing decay, tooth decay in any of those areas. Dentists are not easy to get to or easy to get into, especially for the Medicaid population, and therefore that fluoride is very much needed to be the front guard to prevent tooth decay. So at this point right now, we rank in overall healthy living, we rank 40th. We actually did move up one, so we were ranked 41st, but when the new rankings came out, we were 40th. And so if you take a look at the side pieces, we rank 44th in maternal mortality rate. In infant mortality rate, we are 30th. In cancer mortality rate, we are 43rd. In chronic lower respiratory disease mortality rate, we are 41st. Our lowest is our diabetes mortality rate, but it is still 19th. Heart disease mortality rate is 39th, and kidney disease mortality rate is 44th. So this is the one that I always like to take a look at as well, as it compares our per person funding to other states, as well as the District of Columbia. And it shows that we rank 51st among jurisdictions. And honestly, we would only move to 50th if we doubled what we put in. So even if we move to $14 as opposed to $7, we would still only move to the rank of 50th, as opposed to the highest funder per person, which is the District of Columbia at $365 per person. So this often speaks volumes. I know it did when I took a look at it the first time. So the case for investing at the community level, and really we look at the determinants of health. And so this does make definitely a case for the shifts of investments to upstream drivers of health. So we have the health behaviors and the social and economic factors really coming in at 70% as the determinants of health, with clinical care and physical environment and genes and biology making up the other 30%. So around 80% of what matters for health happens outside of the doctor's office. And so it's really taking a look at how to change what happens in the upstream and work on changing those factors before you ever get to the clinical environment. This is just a look at, and you've probably already seen that, but Missouri's Foundational Public Health Services model. And so we have, of course, our key pieces there in the triangle pieces, which is our environmental, maternal child health, injury prevention, linkage to behavioral and community resources, chronic disease prevention, and communicable disease control. Those are things that we look across Missouri, and most often we think to ourselves that each local public health agency would be able to carry those out 100% for each of their community members, and feel that they could do so adequately. When in reality, we surveyed our LPHAs, and 55% of our LPHAs feel that they cannot carry those out adequately to serve their entire population of their community. And so we know we have work to do even in those key piece areas to be able to provide support for them to be able to meet the needs of their entire population. All the pieces are, of course, encompassed by the health equity and social determinants of health, being able to get the pieces that the services that are needed to the people that need them. If you look in the dark blue, you will see our capabilities. The capabilities, of course, determine how we can carry out the pie pieces in the middle. And a lot of our smaller LPHAs and what I call our medium LPHAs, which are our smaller medium folks, they cannot and do not have access to many of the darker pieces, as they may only have 7 employees in their entire department, which means they don't have things like public information officers, and they don't have a development person. Some of them don't even have planners. And so if you look through the dark pieces of those capabilities, they're not able to tap into those resources, and they don't have the ability to hire someone to perform those when they need them, to be able to carry out the pieces in the middle there that are so key to delivering services to everyone in the community. So we are working at the state level in hopes to be able to provide additional services to hopefully allow anyone that needs additional support to tap into the capability pieces that we would offer at the state level, such as communications assistance, policy development assistance, how to develop community partnerships, any sort of pieces that would need to be tapped into that are not readily available at their local public health agency. We've already really discussed this. So we know that 55% of our LPA, that they were really unable to perform in those delivery areas, which are our middle pieces that we obviously know are key to carrying out public health to everyone across Missouri equally. This is just really a piece that shows how important it is that we have our state, federal, and local partners coming together to build a strong and resilient system, that one piece cannot do it alone. That means we have to have active involvement on every aspect of the three pieces. We still have LPHAs that do not get local funding. They do not have a mill tax. Therefore, they have no ability to have any sort of support locally. So they count on strictly the state and the federal funding. And we are working to help change that. But oftentimes there is a lot of pushback when it comes to that piece of supporting their local needs. So Missouri's Foundational Public Health Services model. So really to work to get to the foundation to become complete in that model, we're going to use federal funds to conduct a costing analysis required funding to implement the Foundation of Public Health Services statewide. We have already started that piece. It is a very long and intricate analysis, and it does LPHAs, as they are the ones providing the information for us to be able to do the analysis. There's a lot of training that goes along with that piece. And so it does take a while. It will take several years for us to be able to complete that. Our public health infrastructure grant is supporting that financially. And we are in the middle of working on that currently. DHSS will work collaboratively with the LPHAs to focus on development areas of accountability measures. And so, of course, we are currently working on that as well. And many of those efforts are also being supported by the Public Health Infrastructure Grant. DHSS believes funding of the Foundation of Public Health Services statewide should be a balance of local, state, and federal funds. As we previously discussed, that balance must be achieved for us to be able to have a strong foundation and solid funding. I've mentioned the Public Health Infrastructure Grant here a couple of times, and I know that we discussed during our COVID, we are currently in the middle of a meeting here in Jefferson City with several of our LPHAs attending, and we do know that currently in the legislature, they have the House has cut the appropriation for the FIG funding. So I guess there was a little bit of misunderstanding as they were looking to cut the appropriation for some funding that had to do with vaccination promotion and getting vaccinations out into the community. And the line item was read incorrectly, and that the appropriation instead that was cut was the Public Health Infrastructure Grant funding, which is a large portion of what we are sending out to LPHAs currently, as we have direct funds going to LPHAs from that line item, as well as other activities. And so I always like to let people know when things like that are occurring, as we are working with our legislative liaison and our partners, of course, to educate. And we have full confidence that the Senate will restore those funds, or I should say not the funding exactly, but the ability for us to spend those funds, as that was the piece that was cut. And so we have not heard any movement from the Senate at this point in time. I think we have 4 weeks left before the budget is due. So we're hoping to hear something about that, as we have the money, but we also have to have the appropriations to spend it. And at this point, that has been cut. The public health infrastructure grant overview, that is just what I was talking about in regards to the funding. So this came down a couple years ago. We worked very hard to build components that would really help LPHAs in regards to their workforce capacity, mental wellness, and how to develop a strong workforce to move into the future, as we know that COVID really took a lot out of our workforce, and it continued to really discourage many different lines of work from getting into public health. And so the first component, of course, was the strengthening local public health workforce capacity. And that was 58% of the funds were made available to LPHAs to respond to workforce needs. So that was direct funding to local public health agencies. Under that piece, we asked that they address mental wellness. So the Department of Mental Health provided additional funding to support mental wellness activities for LPHAs within that contract. And the Department of Mental Health is also creating tools that really will work to combat employee burnout and cultivate that inclusive culture of wellness. We are doing a workforce development piece. So we have our Missouri Pathways internship program, and we work with MSU in that piece, which is building a workforce pipeline via paid internships. As we all know, many students do their internships without being paid, and it is a difficulty and a strain on them. And so we do have a lot of students excited about the opportunity. We have a lot that have signed up. The piece that we are working on is getting additional host sites, as it is DHSS and LPHA being the host sites, and it's difficult for us to keep up with all the students that want to come and take advantage of this opportunity. The learning and development redesign. So we have training modules for leadership and other management skills deployed via LinkedIn. So we were able to buy LinkedIn pieces for each of the LPHAs so they can tap into that learning management system. We are hoping to turn that into more of a hub to be able to create our own content and push that out, which is specifically designed for public health pieces. As we know, there is not enough public health content out there when it comes to training specifically for public health pieces of leadership and HR and management skills. Our electronic inspection and data management system. So this is a new technology which modernizes inspection operations regarding child care sanitation, on-site wastewater, private well sampling, food sanitation. So it really encompasses most of our environmental piece. And it grants LPHAs and DHSS the ability to obtain, manage, and analyze field data, which gives LPHAs across the state access to timely health data. So a lot of our locals were utilizing pen and paper, and so they would go out and do everything, pen and paper, have to go back to the office and enter it, which was very difficult, time consuming. And so we are hoping that this is very much a step in the right direction. Public health services cost analysis. We will provide an accurate assessment of the gap between the current public health funding at the local level and what is needed to implement the Foundation of Public Health Services model, which we discussed, in efforts to increase long-term funding to improve operations, expand those services, and achieve accreditation standards, as many of our LPHAs are not accredited, and it is a very costly process. So we are able to, as it will be noted in the next piece, We are able to pay for much of that technical assistance and to get accredited, as we believe that this is a wave of the future, and that a lot of funding will be attached to whether or not you are accredited. And so in order to be able to make the case for additional funding to our legislature, we really have to be able to determine what that gap is between what we are currently funding our LPHAs at and what they need to have the funding set at to be able to carry out the operations as needed to meet that model. The communication strategy, so that is the statewide communication strategy that will promote a better understanding of what DHSS and LPHAs are working to achieve together. And so really we want to share the same story about public health, the mission, and what it really provides to the citizens of Missouri, as we believe that prior to COVID, maybe people really didn't know what public health did, because we always say if we do our job right, people do not really notice that it's there. And then with COVID, we were put on the front lines, but not for all the right reasons. And so therefore, we really need to get our story told as to what we really actually do, and not be known for just the COVID piece that we were thrown into the limelight for. Some exciting pieces on the horizon. We are actually in the middle of our big infrastructure investment. So this is a 182 million ARPA funding piece to design and construct what we are calling a One Health multi-agency laboratory campus. So that means DHSS, DNR, MDA, MDC, and our Missouri State Health Lab, and our Highway Patrol laboratories would all be in one location. So right now we have public health state, a beautiful public health state lab, and it sits over near the river. It seems brand new, but I know it's been there several years. But really, we would like to incorporate many of our other state labs into that campus, in order to create a multifaceted laboratory system. And so we are working to complete that transformation by December 2026. And we look forward to watching that grow and move forward. A piece of our workforce development. So we know that we have a lot of work to do, and these are the components that we are starting with in the workforce. So CNA training, we are using 1.5 million to help reverse the staffing shortfalls at nursing homes. As we know, that was a large issue during COVID and continues to be, and getting that CNA training to the people that want it and will work in the nursing homes is vital. We have the Missouri GME program, which is $2.3 million to create new residency slots to retain the primary care physicians and psychiatrists we are training. So we have wonderful schools here. We train, we have the best students here, but they have to go to other states to be able to continue their residency, as we do not have enough slots for them. Our Primo program, so we are looking to invest $1 million to expand that program and encourage service in underserved areas. The preceptor tax credit, so that's a $200,000 tax credits will be awarded each calendar year to up to 200 community-based faculty preceptors that are providing training to Missouri medical students or physician assistant students without compensation. And then, of course, we have our public health internship programs that I discussed previously, that we are working with MSU on to get our students in and get them interested in public health and get them that paid internship. And then the public health workforce analysis, which we previously discussed as well. Our vital record system is getting a much needed overhaul, as it was built in the 1970s. And we have kind of just pieced it together and done sort of a Band-Aid system over the years in order to keep it functional. So we have a 5-year return of investment of 5 million for redesign consolidate a myriad of vital record systems that have been built over the last 112 years. So we have a lot of paper records that sit in a very large area that we would like to get moved over. We have microfilm. We have a lot of pieces that need to all be into a complete system in which they are able to be accessed by our LPHAs, as we have a system, unlike many other states that are local public health agencies, are able to produce birth, death certificates as well. But if there is anything that is difficult, such as a long name, or if somebody comes in that is prior to a certain date, our local health agencies cannot assist them, as they have to come to Jefferson City or reach out to Jefferson City for us to be able to assist, as some of those pieces are not in the system. So we're hoping for a 30% time savings for vital records issuance, a 50% time savings for adoption requests, and really a 45,000 hours time saved by team members. So we are excited to see what comes with this vital records overhaul. We have our EWIC implementation. So we are working, hopefully at the end of the path, we will be able to load benefits for our WIC folks automatically, so that instead of having to come into the office, as we know that many of our WIC clients do not have the ability to be able to get to the office on a regular basis. So that ending of loading automatically is actually the last piece. But first, we hope for the decreased checkout time at the store when we're doing our EWIC rollout. Then our second piece is the flexibility to purchase WIC approved foods. And then we're working to combine all household benefits onto one card, and then actually roll into that piece where we can just automatically load the benefits without having to come into the office. So we know that this would benefit more than 80,000 participants at 600 retailers, and we know that WIC has been declining over the past few years, and we hope that this would drive up WIC enrollment if we make it easier, and people can just get on, and their benefits are already there. They don't have to come to the office several times. We really believe that that will be a driver of getting more people that are able and would be WIC eligible to go ahead and utilize those services. And so that is the end. I am happy to answer any questions. I did want to also mention that the EWIC that we just discussed when we were talking about the appropriations piece and how that was cut out of the budget line, and the appropriations piece, EWIC was also included in that budget line item. So the public health infrastructure grant appropriations, along with the EWIC rollout, is both in that line item, waiting and hoping to be put back in by the Senate for the appropriations to spend for the upcoming fiscal year. So I will stop sharing to see if we have any questions or if there's anything I can answer. And if not, then that will be the end of my presentation.
Does anyone have any questions or comments?
I just wanted to really thank Tiffany. She has a long-standing relationship of working with all of the health departments in the state. She's truly a leader and has been very supportive from the time I started as director and way before then too. So I just want to take this time to just thank you, Tiffany, for your leadership and how dedicated you've been to elevating public health in Missouri. The slide that Tiffany showed where we're graded in Missouri is tough for all of us, including Tiffany and her team. And, I'd add to it that in 2021, we were 50th out of 50th in states for per capita spending. So it's folks like Tiffany and the really superb leadership at DHSS that have been working to elevate, support public health and advocate for more support on our behalf at the federal level. So I just wanted to thank you on the record, Tiffany.
Thank you, Dr. Motti. We appreciate your partnership. We are very excited to get to partner with you daily, and it's been a great relationship since you've come to the department, and we look forward to a great partnership in the future. So, and I will keep everyone updated on how those appropriations go, as we will keep our fingers crossed. That FIG investment is very, very important. And so we were all kind of sitting on pins and needles, but we have high hopes.
I was kind of clutching my pearls when you talked about them reading the wrong line item, but thank God that's reversible, right? I'm like, whoa, that was really bad for us.
Yeah, we have high hopes that the Senate will make that reversal. We just have to make sure that it is not forgotten, and that we continue to stay with the Senate to ensure that gets reversed. So to be continued, but fingers crossed.
Other questions for Tiffany from folks?
I don't have a question, but I just want to note that it was, I was just happy to see that the themes, the areas that were mentioned in this presentation are also many of the areas of focus in Dr. Motti's strategy. So if folks have not yet done a thorough reading of the 2023 through 2027 strategy, you'll see that several of the breakthrough goals are some of the same areas that Tiffany mentioned. So it is very clear that there's a good partnership and a level of unity between Dr. Motti's team and what the state is assisting local public health agencies with. So thank you for your partnership. I think it's been very helpful. Does anyone have any additional questions or comments?
I just want to add to the accolades. Thank you so much, Tiffany, for your time and your expertise in sharing that with us, so that we can remain effective board members and help to move the initiatives under Dr. Motti's leadership forward with success. So thank you.
Well, thank you very much for having me. I appreciate you giving me time on your agenda. And the great news is that I get to send St. Louis City Health Department money for me being able to come and talk to you today. So that is always a great feeling, knowing that when I get to send any sort of funding to an LPHA. So it's a great partnership that I get to share information, and I get to meet everyone, and I also get to share money. So that works. I love when it all works. Great plan comes together.
Tiffany, we love you for you, but we love you for them dollars too. Okay.
I know.
Dollars have moved forward the initiatives, Tiffany, and it's like it wasn't easy. There was a history of difficulty in that area. Tiffany was very patient with us as we worked to create better infrastructure to support the fiscal management of the funds that they wanted to support us with. And our commissioner has to be really commended for her incredible leadership in that regard. Craig Schmidt Craig is on this call, I have to give him his flowers, have been really instrumental in turning around how we've been able to be better partners and take advantage of all the incredible support that DHSS has. So I love it. I love it when a partnership thrives. I love that for us.
I do too. I do too. Thank you so much for your time today. I appreciate it.
Tiffany,
All
and
right.
as Tiffany exits, I just wanted to let you know that we will also have a training with the health department staff. We want to make sure that you understand every aspect of the health department. So we will have all the leadership, the executive leadership join to give you an overview of our table of organization, our budget, every single bureau, what they do, priorities right now, and then take questions from y'all as well. It will be similar to this format. We'll try to make it interactive as well. It would be helpful for me, if it's okay with you, our board chair, to just get any feedback on things that you'd like to see in that kind of training, format wise, content wise. If Zoom works for everybody, if you're interested in coming here to the health department, physically, we can accommodate all board needs. So because we're such a new board, I'm happy to take feedback about, what would be best for folks. So any feedback would be great.
I'd be open to meeting in person, but I'm not sure what scheduling needs are for other folks.
Zoom has become really approachable for folks. We could keep the same time and have folks come. And because there's an hour-and-a-half window, we can use that to let folks get here and maybe have more like an 8:15 time, and buffer it so that you still have ample time to get to your next meeting, since there is that hour-and-a-half. But if folks would prefer Zoom, we did that during COVID as well. But Liz, you were about to say something?
Definitely don't ever plan around me. I just want to also be very transparent. My role does involve travel, and it kind of ebbs and flows. So I absolutely love meeting more in person, because I think you get more done and it's a different experience. So whatever dates you do come up with, I will just kind of let you know if I'm able to join in person or not. And my worst case is always Zoom or a call in.
We could do a hybrid too, if that's helpful. So. Other feedback about folks for the training that we will do? Yay, nay, content, or you trust us?
I trust you. I mean, there will be time for question and answer. So if there's something that is not covered, we'll have plenty of chances to ask questions about it.
Absolutely. And it'll be great because you can meet the leaders. These are folks I want you to have direct access to. I'm very protective over my team. I implemented a rule when I came in that any requests of the health department come through me from external partners and external departments, and then I'll funnel them. There was a lot of people kind of giving folks assignments from other departments, from the city, from board members, and it's not tenable for their already really overflowing workflow. But because of how important you are and how you are already leaders in the community, it's important that you know these folks, that if something comes up, you can contact them just as easily as you can contact me. So that opportunity will kind of make that, I think, a little bit more comfortable for you. As our board chair said, they'll also be available to answer your questions in a fireside chat. So we'll make the slide portion a little bit more condensed so that there's more time for organic discussion. And then we'll take it from there. We'll also, as part of that presentation, do sort of like a visual of our website, so you know where to go and how to find certain things as well. It's translatable into 17 languages. So even though it's not the best platform, it's a very old city platform, it's really helpful for our immigrant and migrant community members and partners as well. So we'll do a little bit of a show and tell for the website, different dashboards and things that we have there as well. I will hand back to our board chair, April.
Thank you so much. Well, the last item on our agenda is announcements. The only announcement that I have to share is that our next meeting will be held on May 16th. Does anyone else have any announcements that are pertinent to the Joint Boards of Health and Hospitals?
I apologize. And Craig, I don't know if you have this. I'm going to try to download it. I should have said so the budget, we're in budget season. We received preliminary budgets from our budget director, Paul Payne, a week ago. We were able to give any responses to things that we wanted to appeal or we thought may have been left out or put in error. And then the way that the city operates is there's a committee that votes on and presents the budget that comprises of the mayor, the comptroller, and the budget director, I believe, and the president of the board of aldermen. I'm sorry, the president of the board of aldermen, the comptroller, Darlene Green, and the mayor. And of course, because it's the budget director will be there. That's on tomorrow, I believe from 2 to 4. I'm going to put the information in the chat real quick. The reason why it's important is that you can attend as an observer, but if you also want to advocate for, just talk about the amazing work that we're doing and advocate for the health department, you can sign up by noon today, just your email address, your name, and a sentence or two about what you'd like to say. And to Shannon Davis, I'll put all of this in the chat, and they will make it feasible for you to just briefly speak. So you could be like off camera on the Zoom, and then when it's that time, pop on. Again, I know a lot of you are already very active. It's important that these sort of opportunities are taken by those of you who are seen as not only our representatives, but active members of this board. So the information is in the chat, and with the instructions, you can just copy and paste it from there or take a quick picture for use later. But that was one big announcement. Once they vote on it, it essentially can't be changed. I'll be called before the Board of Aldermen's Budget Committee in May to present the final budget that's been approved by the city. And then the budget goes into effect July 1st. So our fiscal cycle at the city is July 1st to June 30th of every year. The reason this is important is a budget at the city is not fluid. Once a line item has been made, that's the only way I can spend money. If someone comes to me with an amazing initiative during the year, if it's not in a line item, I'm not able to just make funds available to folks. It's a very restricted and purposefully so for accountability process and budget. So it's very important for us to put our best foot forward. And the mayor has been incredibly supportive of us. I'm very grateful for her support, the support of the budget division and the incredible work they do. So it's really hard to get everybody what they want. And right now there are threats at the state level and at the local level to essentially abolish or restrict an earnings tax. That was a huge part of how the city made money. And if it goes through at the state and local level, that's about $150 million that will go for our budget. So the mayor announced a hiring freeze. Please keep, as a board member, you also want to keep in the local news. A lot of what's happening in the city is there. And so that hiring freeze was reported this week. So I am not able to hire new folks, as you heard me say earlier, and the budget will be a lot more conservative this year because the mayor is doing everything she can to make sure that current city employees are okay and the health of our budget is in a good stead until we know what's going to happen with that legislation. That's all I have, April, unless folks have questions about everything I just said.
Well, thank you so much for sharing that. I hope that those who can be present for the budget hearing tomorrow will be able to testify. Certainly, this is a time where voices who want to see growth and movement in the goals of this team's public health work, we certainly need to make our presence known. So thank you so much for sharing that. Does anyone else have any further announcements? All right. Well, hearing none and seeing none, I am going to adjourn this meeting. Thank you so much for joining us. And I look forward to connecting with all of you via email. You'll be getting some documents and some asks, but I will see you all in May. Thank you.